So before coming to the GSB, I've kind of been always in healthcare, though dabbled around a bit. I had a biomedical engineering degree out of undergraduate, and then spent 3 years consulting at McKinsey, and the latter of those years really focusing in on healthcare. And it was around that time that I realized my interest is much more in the kind of systems and services. So overall, what do healthcare systems look like on a macro level, and how do they compare across countries? And ultimately, let's answer the question of how do we deliver high quality care and making it cost effective. So that was really kind of my focus. I spent actually the 2 years before the GSB working in London, for 1 year at McKinsey as well, and then for a year working in the National Health Service. So got a pretty unique firsthand experience to a public sector healthcare model, also working at a hospital, so I had the opportunity to engage with clinicians. And my goal coming into the GSB was to bring kind of this different levels of healthcare knowledge, both with the engineering side, doing the consulting, payers perspective, and also working within a hospital and kind of helping and shaping that within the business school environment. So my internship I spent in Washington, D.C., working on healthcare reform. So I was working in the U.S. Department of Health and Human Services within CMS, which is the Center for Medicaid and Medicare Studies. I spent that actually primarily working on the insurance exchanges, which are a piece of healthcare reform legislation where all the states need to basically provide a marketplace for a lot of the newly insured participants to purchase insurance. And it was an absolutely fantastic opportunity. I learned so much. I can't even begin to really go into it there, not only within healthcare, but just also how the public sector worked. So I think what was great about the GSB was they were always very supportive that there was a good chance I'd go back to my former employer. I had a fantastic experience before school working at consulting at McKinsey and knew there was a good chance I'd go back. And I was able at the GSB to, openly discuss that with professors, with other colleagues, with students, whether that made sense or not. And that's what I pretty actively did during business school. I think especially in the first year and the kind of beginning of second year was pressure testing that, thinking about my experience in my internship and if that was opening new doors or if that was more solidifying that I really liked what I was doing beforehand. And it was a really great time to, for me, be sure that I wanted to continue in the industry I was in, because while it's something I probably could have just stuck with and gone through without, the GSB experience has helped me know that this is something that I really want to do. And moreover, it's provided me with a toolkit that is infinitely strengthened with the experiences that I've had as a result. So I will be going back to McKinsey & Company in New York City, where I began my career, and I'll be working and focusing primarily on healthcare and in their systems and services. And so what that means is I will be looking at kind of working with clients on a macro level. So what are they doing within payers? What are they doing for providers? What are we doing, within entire healthcare systems, and ideally working with some governments and trying to bring the skills that I've developed at the GSB, which I would say primarily are the idea of being able to take different perspectives and understanding the many different things that are happening within healthcare, and especially what's happening kind of at the cutting edge and what are the innovations that are going to happen, push the envelope, and bring that to our clients at McKinsey. So that's what I'm looking forward to doing going forward.